Our program today spotlights an exciting new community partnership for the Rotary Club of York, working with Family First Health and United Way of York County to leverage our support successfully to establish Reach Out and Read as a new collaborative initiative in York. In January, Brian Tate and I returned from the Large Club Conference in Nashville, inspired by the programs we learned about that other clubs our size supported to have positive impacts in their communities. We immediately included Josh George in our conversations, and we set out, as the future presidents of the Rotary Club of York, to determine how we too could make a difference and have a positive impact on a critical issue in our community. We followed that process that included assessing and identifying community needs, research and determine possible solutions, and create a plan that leverages local resources and partnerships to lead to a sustainable success. After multiple conversations with the United Way of York County and the York County Community Foundation, we agreed that education was that critical issue or need, and that a possible program focused on early childhood education, ages 0 to 5, could provide the impact we were looking for. Today you will learn why we chose to partner with United Way of York County and Family First Health to establish Reach Out and Read as a new collaborative initiative in York. I am pleased to introduce our partners so that they can tell you why the coalition they are building is important and what we believe we can accomplish one book, one family at a time that will be making a difference in years to come. It will make our York City youth stronger and more successful in their educational journey. We will also hear from one of our neighboring communities, Lancaster, on the success that Reach Out and Read Coalition that they established in 2001 is having as that program continues to grow and reach more families each year. Please welcome to the podium Sara Bradley, Jenny Englerth, and Linda Gort. Sara is the Director of Education Initiatives at the United Way of York County. Jenny Englerth is the President and CEO of Family First Health, and Linda Gort is a nurse practitioner and Reach Out and Read champion at Southeast Lancaster Health Services.
We're going to start you off with a brief video from the Reach Out and Read that is funded statewide in Rhode Island, and we're going to start you there.
What is that? This pig wanted to have a pancake.
I want a dragon. Yes, let's see the dragon.
If you look at school readiness and you look at the indicators that science has taught us, reading to young children is one of the best predictors that we have that children will be ready when they reach school age. Literacy promotion as part of primary care is an essential component. It's something that should happen at most well child visits starting very early. This intervention not only promotes early learning, but it also helps cement those early relationships, those nurturing relationships with parents feeling empowered to do something that they enjoy, that's fun, and that's really healthy for their children.
Hey, the tracks.
They're the tracks, that's right. And look at all these cars.
Hora de despertarme para un día muy ocupado.
The Reach Out and Read program in Rhode Island reaches close to 30,000 children and families. We hand out 55,000 new, beautiful, developmentally appropriate and age-appropriate books each year, and we are in 51 healthcare locations across the state.
Offering the children books is really truly my most favorite part of the exam, because you can just interact with the kids and you can model to them something that you think will really be valuable to their family.
Kids love the books. Every time I see a patient, hi Dr. Martinez, are you going to give me a book today?
There are certainly patients that we have that this is their first book and their first opportunity to look through it. and it can be the first modeling that the parent sees about reading at home.
I talk about books all the time, and I feel like it's a really powerful tool that Reach Out and Read lets me start right in the early age kids.
It seems as though the whole world is waking up to what we've known for a really long time, that these years from 0 to 5 are crucial.
We're really getting kids when we can have the biggest impact on them, and it's such a low cost and a simple program.
Reading is important at all socioeconomic levels. It's really making sure that every child has access to this program.
Reach Out and Read Rhode Island has constantly been looking at ways of improving the model in primary care practices. They're in there and working on many different areas.
I think the beauty of the Reach Out and Read model is that it is so simple. It's really an interaction between a pediatrician and a child, an interaction between a pediatrician and a parent, and it's advice. It says take the time to read aloud to your children. Take those 20 minutes each day. You don't even know how impactful that will be. And the only other piece of it is giving them the wonderful tool to be able to do this, which is a book.
Reach Out and Read Rhode Island is a game changer.
Awesome, joy, powerful.
Reach Out and Read Rhode Island is fabulous.
I think the most important thing that we can do is to expand into as many pediatric practices as we possibly can.
We're happy to see empty shelves in the waiting room. We just need to work harder to get more books out.
I'm thankful for everyone's generosity in making this happen here, because it's really important to the kids.
I can say, Andrew, thank you, because we really love this program.
We're behind it, we've made it work in Rhode Island, and I think we're going to reap the benefits for a long time.
So I'm going to start. I'm Linda Gort. I am a family nurse practitioner, and that's my only beef with Reach Out and Read. They forgot that there are people other than physicians that do it. Every day we do it. So I walk into an exam room with a book in my hand, sit down with a family, and we look at colors or pictures or see if they're going to eat the book. And I use whatever happens with that baby to talk about the, or child or toddler or preschooler, to talk about the developmental level of that child. In 5 seconds of reading that book, I know that child's on track, not on track, and those parents are on track or not on track. So in 1999, the end of 99, early 2000, I was taking care of a couple of my Haitian friends because there were no people that spoke French in Lancaster County at that time. And my friend was having surgery and I took her kids to the library. And I said, hey, I heard about this program, but I have no idea the name of it, where we would give books in a clinic setting to kids and help to assess their development. And Beth Wagner, the librarian, said, really? Tom Gates and his wife were just in here the other day asking the same thing. So I feel like it was karmic, and we all got together on the page. So we have been meeting since 2000, first at the Neptune Diner for breakfast, and now we have regular board meetings. But all that aside, Reach Out and Read is a powerful, powerful program. It has 3 components: a new book at every well child check, and that's what Jenny has here, a pile of them, and I have a lot in other languages because we have a large refugee population, multilingual in Lancaster County. So it's first a new book, and using that for developmental assessment. Our providers love it, our nurses love it, and our kids obviously love it, because like Dr. Martinez's patient, they come in and say, do I get a book today? So that's problem number 1, is if they come in not for a well child check, where's their book? So number 2 is a huge used book supply. So we have bookshelves in each of our pods filled with used books, so that's an enormous amount of collection. And then finally, reading aloud in the waiting room, so that parents get reading modeled to them. So those are the 3 components. We have built really slowly, I feel like it's slowly, and I can hardly believe it's almost been 20 years. We have a coordinator, a single person, where you guys will have the power of the United Way. And just in the past 2 or 3 years, we've had, so they've been our students that have gone out to private practices, or people that have come from large residency programs in pediatrics who hear how important this is, who are approaching our Lancaster Coalition and saying, we're a private office, how can we do this in our private practice? Because right now we're in 11 clinic sites, so federally qualified health centers, as is Family First and others. I cannot tell you what value this has for the children that your community is serving. Because we know, and I can tell you this, 3 personal stories. I had a patient who was illiterate. She was a young mom. I didn't know she was illiterate. She would sign her name when you'd point and say sign. But gradually, using the Reach Out and Read books, she learned how to read and then said, I can't read well, I need help. And then graduated with a diploma from a local high school. Her children all read, and she brings books to us when she gets them at yard sales. So that's my first story. My second story is my friend Mary Ann, who taught at one of our inner city schools, and said to me, she taught kindergarten, and she taught in a bilingual classroom, and she said, I can always tell Southeast Duke Street kids, that was when we only had one site, because they come in, they pick up a book, and they open it. And they know how to turn pages, and they hold it correctly, which many children don't know how to do when they go to school. So we have lifted up an entire population with Reach Out and Read. And my last thing is this. What do you think the word gap is between children who are read to and are not by age 3? Anybody want to give a guess? 3 million. Your children who are read to, your grandchildren, know 3 million words more than the children that I see every day without this program. And with this program, we are going to close this word gap and make our kids ready to learn and ready to succeed. So thank you for your commitment to this program, because I'm telling you, I'm going to see who's the head of Rotary in Lancaster.
I'm going to just talk about the United Way perspective on this and where we sit here currently in York County in terms of literacy in our programming. You know, Linda gave you the staggering statistic about the 3 million word gap. What she didn't add is that we start to see that word gap as young as 18 months. So through our research, we can tell you as young as 18 months how students are going to do when they enter school. Completely staggering. Okay? Once we know that, okay, we know that 90% of the brain develops in the first 5 years of life. Think about that. The first 5 years of life. Okay? And majority of our kids have either a single parent household or 2 working parent households where they go somewhere throughout the day, whether that be family, whether that be with an early learning center. And we also know here in York that even if you wanted to put your child in a place throughout the day, a quality place, only 16% of our kids will even have access to a high quality spot. They don't exist. Okay, and when I say quality, I mean deemed by the state a quality program. Okay. We also know here in York, our first research indicator of academic success across the country when they enter school is the ability to read proficiently by the end of 3rd grade. Okay. Does anybody want to take a guess on how many kids can read proficiently or cannot read proficiently by the end of 3rd grade here in York County? 70% can read or cannot? They can. About 70% can. So about 28% of our kids here in York County cannot read proficiently by the end of 3rd grade. Okay? Why is that a problem? Because once they start, at 18 months, we can start developing this. We see it. We see the trend. Those 18-month-old, they're behind. They go to kindergarten, they start behind. By the end of 3rd grade, they can't read proficiently, and they are behind. Okay? Yeah, and 90% of development happens in the first 5 years. Okay? Critical that we hit them early. By the end of 3rd grade, what we know is that teachers no longer teach kids how to read. And public school teachers are not trained to teach kids how to read to begin with. It's not something that they learn. It's something they have to get additional practice on. Okay? It's not something they teach in our standard teacher courses. Okay? That when you finish 3rd grade and enter 4th grade, you are no longer taught how to read. You are reading now to learn. Can anyone see why that's a problem? If you can't read, then we start seeing kids that don't want to go to school. And then that trend continues. And my most staggering statistic Now we have to reevaluate that, but about 5 years ago, 1 out of 4 kids in York County is not graduating on time or at all. Okay, do you see our trend? All right. At United Way, we've been doing, since 1994, we've been focusing a lot of our efforts on early childhood education here in York. A lot of that has been focused on literacy. What we have been able to do is we've been able to partner significant partnerships with our early learning centers. Some of our public school systems, we've been working on that for a long time, to kind of bridge those gaps between ECE programs. What we cannot and have not been able to figure out to do is how do we reach the unreachable? How do we reach those kids that aren't in an early learning program? How do we reach those kids that aren't attending the library systems or aren't going to those programs where we know young kids in our traditional sense, as we in this room would take our children to? How do we reach those kids? Because there's a whole lot of them. Okay? We have been looking at Reach Out and Read as a viable program here in York for about 3 years. We had to do a lot of research on that first, figure out who's currently using the program, where that was going to go, and we are ready now. So we are actually starting the coalition here in York. We'll be putting together this summer throughout the fall, and our first recipients of this coalition will be Family First Health with Jenny Englerth. And I'm going to let her come up for just a few minutes and talk about what that's going to look like for her. So thank you very much. And keep serving. I appreciate that. Keep thinking of your own kids because there's a lot out there that need our help. Thank you.
Good afternoon. I'm Jenny Englerth, and every day I get to work with a great group of doctors, nurse practitioners, physician's assistants, dentists, dental hygienists, and all kinds of other great folks who like to do nothing more but do good for the families who choose to come to any of our care sites across our service delivery area. Around our office, you'll see several quotes, and one of those had a particular relevancy for me as I thought about talking to you all today. And it's a quote from Maya Angelou, and it reads, "People will remember not what you did or said, but how you made them feel." And I think while I respect and it serves as an important foundation to understand the science and learning behind attaching children in their earliest months and years to good literacy skills and empowering their parents or caregivers to serve in the role of guiding them, the relationship between a caregiver or a reader and a young child in a book is about how it feels. And I think if any of you can think to those moments of reading to your children or grandchildren or neighbors or being read to yourself, you'll easily be able to recall that feeling. For me, it's about a book called No More Jumping on the Bed that I could recite for you if we had the time today, I do believe, because many of my evenings were spent reading that book that describes the young boy who jumped on his bed too much and traveled 8 floors down through his apartment building and interrupted all kinds of great activities his neighbors were participating in. And then even further back than that, my memories are of my mother getting off night shift at the hospital and coming home to read to me over breakfast. And she enjoyed the classics. So she read to me everything under the sun. I only learned as an adult that it was really a trick to help her fall asleep. She then put me on the bus. But regardless, we got our time in and our reading in. And it's those moments those moments of connection that go along with and support word count development and brain development and all those things that we understand are so important, but the tie that binds them together is the connection that happens when we can create that moment. When I think about the professionals within our organization and the work that they do every day to try to fill the gaps, they're all well trained as medical providers, dental providers, social workers, but every day we identify gaps, places where our training, our expertise, the tools that we have don't really meet the need of the child or family that's in front of us. And this program serves to fill some of those gaps and equip them with the tools and learning that they need to do better at their jobs every day. In the past year, and I wanted to say this connection between education and health among our providers and what we know and see in our families makes this program an ideal fit, and I'm sure was part of the foundation of the creation of this national evidence-based program. We, as we work and have those interactions each year, in the past year we had nearly 1,700 of the interactions that will now in the coming year include a book and the ability to have a more robust developmental assessment with using that book as a tool to help the providers in that endeavor. That they're already doing with families through what some of you may remember, those preventative visits, those well-child checks. We interact ideally with families between 6 and when their children are between 6 months and 5 years, a total of 11 times. And so that provides us with a great opportunity. That group that Sara was talking about that may not be in a child care setting, may not be connected in other ways, hopefully, and more often than not, they're coming in to receive medical care. And if we can deepen that opportunity to pick up on some of the areas that may be being missed in other ways and leverage that provider-patient relationship, which does matter to our patients. They do respect what they hear from our providers because a relationship has been built over time. And so to model the information that Linda described really has a different meaning when it happens in the context of an exam room. And so the opportunity that you're supporting to give those tools to help make that connection, deepen the work that we're already doing, and do that in a significant way across York County is greatly, greatly appreciated. The support for infrastructure is huge, so the role that United Way will be serving to help lift some of the administrative burden from this program from any individual medical provider is huge. We can focus on those things that we do well, and United Way, which has already been our partner in so many fronts, can focus on those things that they do well. So we're very excited to move ahead. We're so pleased that this club has entrusted their support to Family First Health and United Way once again, and we're anxious to move ahead with the work. So thank you very much, and we'll be glad to come back and share some results in the future.
Typically when we give presentations, everyone's like, how can we help? How as you, as a Rotarian, can help with our literacy crisis here in York? A lot of you probably have children, grandchildren. I can tell you that over this last weekend, purged my children's room, we have 4,700 books in our household. 4,700. Divided by 3, that's a lot. A whole lot of books. The average at-risk family in their entire household has between 0 and 2 books. Okay? That doesn't mean they're kid appropriate. That doesn't mean they're developmentally appropriate. That means 0 to 2 books total. Okay? As a Rotarian, if you're going through your households, okay, if you have books that are left over in your garages that are still in, new or gently used shape, please feel free to bring them to the United Way. Part of this program is we are also creating literacy-rich environments throughout the entire office, not just at that well-visit checkup. We have put reading ready corners and Family First Health locations in the WIC office and a lot of places around York where we're getting these books out to families that may need them. So thank you again.
Jenny and Linda, could you come back up, and I'd like to open this up to the club if there are any questions for our 3 speakers. Does anyone have any questions?
I do some tutoring in the city schools in Jackson, and I can see the difference that you're talking about between the kids who don't have good preschool experience. As a volunteer, just I like to read the kids, what can I do? I mean, I think I'm uncomfortable going to a doctor's office in a way, but what else can I do?
Yeah, we do. We have volunteers, and we have a training program, and Diane's going to feed into the York County side.
One of the things that I'm going to be asking our literacy Oh, the question was, what can I as a volunteer do to help read with kids and to help with this program? And one of the things that we'd like to do here that I'm going to talk to our literacy committee is actually putting together a reading program through the literacy committee here at the Rotary so that Rotarians and Rotarian spouses and friends can go out and be part of that troop that goes to Family First Health and actually does some of that reading aloud to kids in the waiting room waiting to go.
I did that took 2 times, and nobody came. We sat for 3 hours and nobody came.
Well, my hope is that we can actually create a schedule with Jenny's help as to when those high volume times are in her facility, that we can do that. And there is also a training program that we can work on that will actually do a small training program for Rotarians who maybe haven't read aloud for a long time and need a little bit of support on how to do that and how to actively get the kids involved with that as well. So stay tuned and ask your husband to keep you in tune with this. But we will be, I'll talk to you directly, Pat. We'll be working on a program that can hopefully help our Rotarians get more involved in that type of reading and make it, a good impact for us.
It sounds like a great program. Can you help me understand the 3 million gap that number?
Yeah, it's pretty astounding, but it's figuring how many times when people talk to their kids and don't use vocabulary, use the same words over and over. It's a
I guess I'm just confused. I mean, the average vocabulary is like tens of thousands. So where's the 3 million come from?
It's a composite number.
Okay.
It's a composite number in the research. Research is at the University of Oregon, and I have to say that, but it's a million of all those children that
So
they
it's a group of
study.
children. Okay.
Yeah, but
Well,
still the difference is. Oh, I'm sorry. But that is such an astounding number.
Okay.
But it's a more than 50% difference. It's about a 70% difference in vocabulary strength. Yeah, and that is at 18 months. That is at 18 months.
Nice.
You gave a statistic that by the end of 3rd grade, 28% of kids are not reading proficient.
Of 3rd graders, correct.
3rd graders. How are we defining reading proficient?
That is the only way we can determine that is by the standardized test from the state. So we are looking at the PSSA scores that are coming out of each and every single one of our school districts.
Does this program have any way of dovetailing with America's Promise?
We talked about the fact that America's Promise goes in and reads to kids in schools, and part of this program and part of what United Way also does that. So one of the things that we'll be looking at is, as we look at the Literacy Committee and we look at America's Promise, we want to make sure that we're not overlapping on what both of them do to try to accomplish and help make this happen. Reach Out and Read is focused on that 0 to 5 age bracket. So our America's Promise is going into the schools and hopefully picking up where that left off and continuing to focus on that reading proficiency. All right, thanks for